Ever wondered what psoriasis is and why it occurs? It might sound like a complex puzzle, but this video is here to unravel the mystery. Psoriasis, for those who may not know, is a chronic skin condition that has been a subject of study for many years. Chronic in this context means that it's long-lasting and typically requires lifelong management. Now, when you hear skin condition, you might imagine something contagious, but that's not the case with psoriasis. It's completely non-contagious, so you can't catch it from someone, nor can you pass it on. But what exactly does it look like? People with psoriasis often have patches of red, raised skin covered with silvery scales. These patches can appear anywhere on the body, but they're most commonly found on the elbows, knees, scalp, and lower back. It's not just a cosmetic issue either. Psoriasis can be itchy, painful, and in severe cases can even affect the joints. Psoriasis is a global condition affecting millions of people around the world. It doesn't discriminate based on age, gender, or ethnicity. Anyone can get it, and it usually starts showing up in early adulthood. However, it's also been known to appear for the first time in middle age or even old age. Despite its prevalence, there's still a lot of misunderstanding and stigma surrounding psoriasis. Many people mistakenly believe it's a result of poor hygiene or lifestyle choices, but that's not the case. Psoriasis is actually an autoimmune condition. This means that it occurs when the body's immune system mistakenly attacks healthy skin cells, causing the rapid buildup of skin cells that leads to those characteristic psoriasis patches. But why does the immune system do this? What triggers psoriasis? Those are questions that researchers are still trying to answer. As we continue this journey of understanding, we'll delve deeper into the skin's role in psoriasis, explore its causes, and shed light on the latest research. So, let's dive into understanding why psoriasis occurs. To understand psoriasis, we first need to understand a bit about our skin. Our skin, the body's largest organ, acts as a protective shield. It guards us against environmental hazards, regulates our body temperature, and plays a crucial role in our sense of touch. But beneath the surface, it's a bustling microcosm. New skin cells are born deep in the lower layer of the skin, known as the dermis. These cells gradually push their way up to the outermost layer, the epidermis. On this journey, they mature, transform, and eventually die, turning into a tough protective layer. This process, termed cell turnover, takes about a month. Now, imagine this orderly process going haywire. In people with psoriasis, the cell turnover happens at an accelerated pace. Instead of the usual month, it takes just a few days for new cells to reach the surface. This rapid pace doesn't allow the old skin cells to shed in time. So they pile up, forming thick scaly patches, or what we call psoriasis plaques. So why does this happen? Well, psoriasis is an autoimmune condition. This means the body's immune system mistakenly attacks its cells. In this case, it triggers inflammation and speeds up the skin cell production. Psoriasis isn't merely a skin concern. It's a chronic disease that lasts a lifetime. But it's important to note that it's not contagious. You can't catch psoriasis from someone else. In essence, psoriasis is a tale of an overactive immune system and an accelerated skin cell life cycle. It's a story of cells maturing too quickly and not being shed fast enough. It's a narrative of skin's normal harmony getting disrupted, leading to the formation of plaques. Now that we have understood how our skin functions, let's move on to the causes of psoriasis. Psoriasis, like many conditions, results from a combination of factors. It's a bit like baking a cake. You need more than just one ingredient to get the final product. Let's dissect these factors one by one. First up, we have genetic factors. Yes, your genes can play a significant role in whether or not you develop psoriasis. This disease tends to run in families, which suggests a genetic link. Studies have shown that if one parent has psoriasis, a child has about a 15% chance of also developing the condition. If both parents have psoriasis, that chance shoots up to roughly 50%. But remember, having a genetic predisposition doesn't guarantee you'll develop psoriasis. It simply means the potential is there. Next, let's talk about the immune system. Our immune system is like our body's personal security team, protecting us from harmful invaders. However, in people with psoriasis, this security team gets a little overzealous. Specifically, a type of white blood cell called T cells become overactive. These T cells are like the body's foot soldiers, usually fighting off bacteria and viruses. But in psoriasis, they mistakenly start a war against the body's own skin cells. This leads to an increased production of both skin cells and more T cells, creating a vicious cycle. The result? Those characteristic red scaly patches that people with psoriasis know all too well. This overactive immune response is why psoriasis is considered an autoimmune disease, a category of conditions where the body's own immune system goes rogue. But genetics and immune system are not the only factors. There are triggers too. So buckle up, because in the next segment we'll delve into the environmental and lifestyle triggers that can set off a psoriasis flare-up. Stay tuned. Apart from genetics and the immune system, certain triggers can cause psoriasis. Let's delve into some of these triggers and understand how they contribute to the onset of psoriasis. Firstly, stress is a significant trigger. When we're stressed, our bodies respond by releasing chemicals that cause inflammation. This inflammation can prompt the immune system to produce more skin cells, leading to a psoriasis flare-up. It's a vicious cycle because the discomfort of psoriasis can also cause more stress, thereby intensifying the condition. Next, skin injuries such as cuts, scrapes, or severe sunburn can also trigger psoriasis. This phenomenon, known as the Kubner response, occurs when new psoriasis patches develop on areas of skin injury. The reason behind this is that the skin injury stimulates the immune system to produce skin cells at an abnormally fast rate, resulting in psoriasis. Certain medications can also trigger psoriasis. These include anti-malarial drugs, lithium, and certain blood pressure medications. These drugs can affect the immune system and cause it to overreact, leading to a psoriasis outbreak. Infections, particularly those caused by bacteria or viruses, can also lead to psoriasis. The immune system reacts to combat these infections, and this reaction can sometimes result in an overproduction of skin cells, causing psoriasis. Lastly, weather changes, particularly the onset of cold, dry weather, can lead to psoriasis. This is because dry air can suck moisture from the skin, causing it to become dry and potentially leading to a psoriasis flare-up. On the contrary, warmer, humid climates are usually beneficial for people with psoriasis, as they help keep the skin moist. In conclusion, psoriasis can be triggered by a variety of factors, including stress, skin injuries, certain medications, infections, and weather changes. Each of these factors can stimulate the immune system or directly affect the skin, leading to an overproduction of skin cells and, subsequently, psoriasis. So we have seen how a combination of factors can lead to psoriasis. So why does psoriasis occur? Let's take a moment to reflect on what we've covered so far. Psoriasis isn't a simple skin condition, but a complex interplay of factors that converge to create the characteristic red, scaly patches that are its hallmark. To begin, we delved into how genetics play a crucial role in psoriasis. It's not a condition that you can catch or pass on like a common cold. Instead, it's a condition deeply rooted in your genetic blueprint. It's like a dormant volcano that's always been a part of the landscape, sometimes quiet, sometimes erupting, but always there. Then, we moved on to the role of the immune system, a key player in the story of psoriasis. When functioning normally, our immune system is like a well-trained army, defending us from external threats and maintaining peace within our body's borders. However, in the case of psoriasis, the immune system gets a little overzealous. It starts to see our own skin cells as foreign invaders and mounts an attack, leading to rapid skin cell turnover and the formation of those distinct patches. Lastly, we explored the various triggers that can ignite this condition. These triggers are as individual as fingerprints, varying from person to person. For some, it might be stress or a particular medication. For others, it could be a skin injury or infection. This variety makes it challenging to predict or prevent flare-ups, but understanding your unique triggers can be a powerful tool in managing psoriasis. So, we see that psoriasis isn't caused by just one factor, but is a symphony of genetic predisposition, an overactive immune response, and individual triggers. It's a complex condition, yes, but not an insurmountable one. By understanding the causes of psoriasis, we can better manage the condition, and improve the quality of life for those affected. With knowledge comes power, and with power comes the ability to change our lives for the better.